Hey guys, today is the third day I've been home from the hospital after my surgery, and yesterday I had quite an episode. Yesterday morning, I had some trouble breathing and some issues, I think, with my medications, but got everything figured out. I kind of wanted to just go over some of the medications that I'm taking right now. This isn't what every doctor would prescribe. Every doctor is different. Every doctor will, you know, they'll go about this procedure differently. So I just wanted to tell you a little bit about what mine look like. Um, so the first thing I take is morphine. I take a 30 milligram morphine pill in the morning, and I take a 30 milligram morphine pill at night. These are long lasting pills. They last all day long. They last for 12 hours, so it's not like getting injected with morphine. It's little doses of it throughout the whole day. Another one that I take is oxycodone. Oxycodone I take a lot. I take every 4 hours. I take some oxycodone, either 1 to 2 tablets as needed. That's also for pain relief. And I take a couple new ones. I take something called gabapentin, something like that. It's a drug that is for pain relief in your nerves. It's a nerve pain reliever. And since most of everything that's going on, all the pain that I'm feeling, is nerve related, it's kind of it just focuses on that. And there's another one. It's called methocarbamol, or Robaxin. Robaxin is the normal name that you would hear. It's for back spasms and muscle spasms. It's a muscle relaxer. It's kind of taken place of what I was taking, which was Valium, even though I do still take the Valium for anxiety, because I definitely still have quite a lot of anxiety and panic attacks that come with all this. So yeah, I'm continuing the Valium. I'm also taking Tylenol. Now, before I was taking Percocet, which is oxycodone and acetaminophen combined. Now I'm taking oxycodone and Tylenol, which is acetaminophen. I'm taking them separately. Not sure why. I think they want me to take. I think they want me to be able to take more oxycodone than the Tylenol, because acetaminophen can really tear you up if you take too much of it in a day. With all that comes a whole gambit of laxatives that I get to take. There's a couple main ones, Docusate or Colace and Senna, which are the ones that the doctors typically will prescribe or want you to pick up from the pharmacy. They don't really want you taking X-Lax or whatever drug is in X-Lax. They don't want you taking that for some specific reason. I think it starts messing with your digestive system in a bad way. Miralax is a powder that you mix with water that you drink, and it's a laxative, and milk of magnesia. Those are a couple other ones. I haven't been taking those. I've only been taking the Senna and the Colace. Now, yeah, they wanted me to stop taking X-Lax. They wanted me to stop taking Percocet. They also wanted me to stop taking ibuprofen or Aleve. The reason for that is because they're both ibuprofen and Aleve they're anti-inflammatory medications that can disrupt the fusion of the bones that's happening. I don't know how it disrupts that, but they definitely wanted me to stop taking Aleve and ibuprofen while these bones are fusing together in my neck. And I'm definitely not supposed to drive a vehicle at all. As far as my incision goes, which is, you can barely see it right now, but you see these little strips of tape that are covering it up right now. You're obviously supposed to keep that clean and dry. And I'm allowed to take a shower 3 days after the procedure. So today I'll be taking a shower finally, which is going to be awesome. When I left the hospital, there was some plastic surgical dressing that was covering that whole area. In the last video, I showed how I was peeling that off, and some folks thought that I was actually peeling off the tape. That it's not the tape. I'll repeat that. I did not peel the tape off. I only peeled the surgical dressing and gauze off that I was instructed to peel off after 48 hours after my procedure. The small pieces of tape, which you can see have been left here, they will fall off after about 10 to 14 days. And if they don't, I'm supposed to, while taking a shower, just get them, dampen it and very gently remove those pieces of tape. I don't have stitches in this incision. I have these steri strips, which they basically fall off with the tape, and then it's basically being held together from underneath, I think. But that incision after about 2 weeks should start to heal and close up, and it might even disappear, which I kind of want the scar to show off, The drugs that I'm taking, I'm seeing my regular physician here in a week to talk about tapering off all the pain medicine, which I'm really looking forward to, because as you can tell, I'm in a daze. I'm not really, all there, and I know you can tell. But here in about a week, I'm going to see my regular physician, and we're going to work out a schedule on tapering off all these hardcore narcotics that I'm taking. And then in 3 weeks, I'm going to see my neurosurgeon again. And I think that during that appointment, or at least I hope, they'll do an X-ray of my neck to see the metal plate and screws and everything that's in there, and we can see how far along I'm coming with the fusion on these bones. The bones are supposed to take 6 to 8 weeks to fuse together, kind of like when you break a bone and they put a cast on your arm or whatever. That process takes 6 to 8 weeks. It might even take a little longer than that, just because the bone that's fusing together with my bones is not my bone at all. It's a donor bone. So that fusion, that's what's gonna keep everything together and keep me from having this terrible pain anymore. The nerve pain that I was having down my right arm isn't there. Again, I'm on a lot of drugs, so we'll see how I'm feeling here after I start tapering off all this stuff. I've been sitting in this recliner every single day watching Netflix. I think I've watched every behind the scenes making of iTunes extras on every movie I've ever bought. And I've been eating nothing but oatmeal and yogurt and bananas and just really soft food, because my throat is, as somebody put it, it feels like I swallowed a Timberland boot, and it's stuck it there in my throat. I totally stole that from whoever said that on Facebook. But anyway, I'm doing fine today. No episodes, no anxiety, no issues. So I'm gonna get back to watching more and more Netflix and Hulu, and we'll see you all later.